And we want to welcome back Paul Seegert to the program. He is a managing partner at PCS Advisors. This is a health benefits consulting firm, and they have 35 partner offices across the country. And he is going to talk about how Obamacare has expanded, but that may not be the greatest situation. Good morning.
Good morning. How are y'all today?
Doing well, doing well. So share with our listeners what has happened over the last year or two with regard to Obamacare and people crossing over from conventional health care to going to that.
Well, since in the last 2 years, we've taken enrollment in these programs from 27.1 million to 35.8 million. So we've added quite a few to the rolls. And if you're a supporter of these, of kind of the Affordable Care Act, then a lot of folks will point to these numbers and as a sign of the success of the program. When you dig down into the numbers, it's kind of interesting to see what really happened there. In that same period of time, we changed the uninsured rate in this country. We moved the needle only by 4.9 million. So we had 8.8. We went to 8.8% of Americans that were uninsured from 10.3. But to me, looking at the real number, that 4.9 million, that tells you that we took it from 27.1 to 35.8 and only added 4.9 million that didn't have coverage before or coverage already. So we created a situation where people gave up other coverage. Maybe they had coverage at their employer or they had an individual plan, and they left that coverage to get government subsidized coverage because that became more attractive to them personally. So we created a kind of a draw there that moved people that were covered onto the government, either subsidized or provided coverage.
And Paul, what does that do? What does that mean in terms of, will people, they got some special benefits from subsidies, whatever, from Obamacare, I think. And that was kind of the draw. But that may go away, those subsidies? Yeah,
it was part of the American Rescue Plan legislation around COVID. We created extra subsidies, and then because we declared a public health emergency, then we told the states basically, hey, we've got this extra money, and if you don't, and then you can't verify whether people continue to qualify for coverage during a public health emergency. If they're on it, you just have to let them be. So, whereas normally the states would be continually checking those that were enrolled to confirm they still qualify for Medicaid, as an example. And if they didn't, because perhaps their income went up or they regained employment, that kind of thing, then they would get removed from the program or kicked off the program, lose that coverage. But they would lose it because they no longer meet the requirements. And during this public health emergency, we changed a couple of things. Well, one significant change is that states were not checking to confirm people still qualified for coverage. And then another change we made was removing the 400% of the federal poverty line rule as a top end where you would get access to subsidized coverage. We made it so that any person who went to an exchange to enroll wouldn't have to spend more than 8.5% of their income. And so when you do the math on some of that, we were even providing subsidy. You could be a 60-year-old couple making north of $200,000 a year, and you still got some subsidy for your coverage if you went to the exchange. And some people would argue that maybe isn't necessary, that maybe that wasn't the best way for the government to spend tax dollars.
And there are some people, so obviously in that particular scenario you just mentioned, that could be people making, as you said, north of $200,000 a year. They're opting for Obamacare rather than whatever their employer provides, probably, right?
Yeah, and that stuff wasn't getting verified during this public health emergency, so there wasn't good oversight of that. And when that happens, we call it moral hazard in our business, or you kind of create, you set the fresh cookies out on the table and they smell really good. You can't blame your 4-year-old for coming down and eating the cookies. We kind of created an attraction there. So now there's some discussion around what will happen now when they end this public health emergency, and that public health emergency related to COVID has been continuing to get extended, and we're supposed to see that this public health emergency ends. And when it ends, then states will go back to verifying people's status, and people will start to get removed from the program. And there are some who think perhaps it may get extended again, whether it's needed or not, because it would be pretty inopportune timing politically to have a lot of people lose coverage or subsidized coverage.
That makes sense.
Right now.
What about Medicaid coverage?
Yeah, this includes Medicaid. So we had, if you look at the numbers, that 35.8 million, you've got 21 million of those are from Medicaid expansion. So, and that's always been true with the Affordable Care Act, that really a lot of what happened there was expansion of Medicaid in terms of numbers of people that gained coverage.
So what is this going to do for people that opted to save some money, jump on Obamacare, and then if they have to go back to their other health care coverage? Well,
they'll have benefited for the time that they were on the program. They aren't going to go back and penalize anyone. Which was, I think, part of that moral hazard I talked about, is that they communicated that they weren't going to verify, and there would be no penalties later. Now, it used to be when we're not in these public health emergencies, if you were to enroll in these programs and not do it correctly, then they could claw back some dollars, maybe in your tax return or whatever. That's not going to happen. So they benefited for the time they benefited, and as soon as the public health emergency ends and some of these things start to get cleaned up, they'll have to go back to another source of coverage, whether that's through their employer, or it may be that some of them move from Medicaid to, likely many will move from Medicaid to a plan on the Affordable Care Act exchanges, where they will still have some subsidy. It may just not be entirely free.
Okay. Well, thanks for the explanation, Paul. We've been talking this morning to Paul Seegert, and he is the managing partner at PCS Advisors. That's a health benefits consulting firm with 35 partner offices across the country. And, Paul, where might our listeners find out more information?
Well, we help employers reduce the cost of their health plans for their employees and improve the quality, and we can be found at tcsadvisors.com. We spell it ERS, not ORS, and we're happy to help if we can.
All right, Paul Seegert, thank you so much.